Well, hello, everybody. Hello. Okay, I think everybody's excited about this topic, and we're happy to have you here. All right. I'll do what we did with our kids or in QI. We raise our hand so people will be quiet. You are in the mental health hot topic room. If that is not where you want to be, now would be the time to get up and find the room that you want to be in. We want to make sure that you get the most out of this VLC. So, mental health has been discussed a few times already, and so I'm glad that you're here to discuss a little bit more. I want to introduce myself. My name is Paula Lomas. I am Senior Director of Clinical Communications at the CF Foundation. I have had that role for a little over 4 years, but I started out in CF way back in 1988. I started out as a pediatric nurse coordinator in a little CF care center. I stayed in pediatrics for a time. I moved on to adult care, and I even had a stint as the research coordinator. So I've done a lot in the area of CF nursing, and it really is a great privilege of mine to work at the CF Foundation. And so because my roots are at the clinical care level setting, my role is to make sure the care team members have the information that they need in order to provide high-quality specialized care that's required for CF. And one of those areas is in guidelines. And of course, mental health falls under that. So I would like to also hand over the mic and have my co-moderator, Ginger, introduce herself.
Thank you, Paula. My name's Ginger Birnbaum. I know a lot of you because I asked you to come. I'm so excited to share this information with you. I just, for much of my life, have felt very, very passionate about mental health. And then I had a child that was born with cystic fibrosis, and I have a daughter who is not living with cystic fibrosis, but really is. So for our family unit, it became such an important thing. And to see that the Cystic Fibrosis Foundation is truly devoted and committed to making an impact where mental health is concerned has just been incredible. And so it was a tremendous privilege to get to be a part of the Mental Health Advisory Committee and to use my voice and my passion and hopefully turn some of that into action. So I'm so glad to be here with you all today. And I would just note too that you are leaders in this community, and many times you're ambassadors in this community. And so I hope that if you're touched by what we say today, if you're interested in what we say today, you'll share that with those that you love back home. And for anyone that is watching online, we're just so happy that you're here with us. And this is very much for you, especially those of you with CF. And we're always just happy to do what we can for you too. Thank you.
So the way that we would like to run this session is that we're going to share with you where we are in mental health, what we've done to date in order to support this initiative. And then we would like to open it up for comment and questions. We would like to hear from you. We would like to hear from you, what gaps do you notice? What should we focus on so that we're able to bring it back to the Mental Health Advisory Committee and discuss it as we plan for the future. So with that, I want to make sure that I say, if you do have a question or a comment, I'm going to be a real stickler about asking you to come to the mic so that those who are online can be sure to hear the question and hear what you have to say. I also wanted to make sure that I mentioned how you can ask questions if you want to do so online instead of coming up to the mic. Some people don't like to speak at the mic. And again, you would go to vlc.cnf.io, and then you can add your questions there. You can ask at any time. Doesn't mean that we'll answer it at any time, but we will be taking time for question, answer, and discussion. So what I wanted to make sure that I say to you is I want to remind each and every one of us that our well-being is informed by our physical as well as our mental health. Right? Each of us has to go through times of anxiety or depression. And we know that anyone with a chronic illness, like cystic fibrosis, or those who care for someone with a chronic illness, are going to have times of anxiety and depression. And that is because it is a very natural thing, a normal thing, to have anxiety and depression when you deal with very, very difficult situations. But we did not know what the prevalence of anxiety and depression were until we embarked on the TIDE study. TIDE stands for the International Depression/Anxiety Epidemiological Study. And it was a study that was funded by the CF Foundation. It took place in 45 CF care centers and 8 European countries. So it really was an international endeavor. And what we saw was, yes, individuals with CF, those who were adolescents and adults, as well as their parent caregivers, have had an increased prevalence of anxiety and depression. And in fact, it was 2 to 3 times greater than the general population. Well, this was for anxiety as well as depression. I just have the anxiety scores here, but it really was for both. And this was a call to action for our community. What were we going to do with this information? And so what we did was we brought together an international group. Once again, the CF Foundation joined with our international colleagues, and we convened a guidelines committee. And the guidelines committee went through the evidence, and they came up with recommendations. We call these the mental health guidelines, but mental health is a huge umbrella. And they decided just to focus on anxiety and depression. And that really has been our starting point. And I want to point that out. All of this is really just a start, a great way to start. We knew we had to start, and this is where we decided to start. The guidelines are posted on cff.org. If you want to read the whole guideline, they're there for you. But if you would prefer, we also have an executive summary on cff.org. And what it shows is really the key recommendation statements that were made for these mental health guidelines. And what was recommended was that individuals ages 12 and older should be given a screening for anxiety, depression at least once a year, and that their parent caregivers should also be offered screening at least once a year. That's been a little more difficult for some of the care centers to implement. It's not that they don't want to, but sometimes their organizations won't allow them to. And I want to make sure that you understand that. Some care centers have figured out a way, though, to offer self-screening to parents. And then also some resources that they can have in order to go back and see really where are they fitting in. Are they scoring high for anxiety? Should they seek some further help? Well, guidelines are one thing, but implementation is a little bit harder. And the guidelines were published in October 2015, and Dr. Bruce Marshall understood that this was going to be tough for care centers, and how could we best help them? And so he convened a task force. He mentioned that yesterday. And what they came up with was their recommendation for utilization of the collaborative care model. And what that meant was that someone would be embedded in the care center as part of the team to implement the screening, and also, if needed, that they would implement the intervention that was required. But perhaps they weren't able to provide that intervention. They should be able to refer to appropriate care. So that was the recommendation. And so with that, we embarked on seed funding for care centers, and we offered the mental health coordinator grants. To date, we have funded 138 programs with a mental health coordinator. And in fact, those who received the grant the first year, in 2015, they were at the end of their grant cycle, and we've also offered some bridge funding to some. And I hope that you recognize that since 2015, our healthcare landscape has changed a bit. And so when the original grants were submitted and the thought of how they were going to pay for this person and sustain that position, things really have changed in healthcare and the cost of things and the coverage. So it's been a little more difficult, I think, for some teams than they had originally anticipated. What we also did was in April of 2016, we brought together a group of subject matter experts, and we had the Mental Health Advisory Committee. This is a multidisciplinary committee. We have psychologists, psychiatrists, adults with CF, parents of children with CF, nurses, all part of this, and social workers, all part of this committee. And I'm going to ask Ginger to speak a little bit more about that group.
So, yeah, this is the committee that I have the privilege of being a part of. Our mission, as you can see, is to promote and support the mental well-being of individuals with cystic fibrosis and their families, which is key, through a partnership with CF Care Centers to provide screening, preventative interventions, and ongoing innovative services. So I think one thing to point out to you is we are really working to provide this through the care centers, through these mental health care coordinators. But what you will see on cff.org many times is that information is pulled through there so that you have access to it outside of your care center as well. So this is the makeup of the committee. We have 3 buckets: education and training, which I get to be a part of, consultation, and research. It's chaired by Dr. Beth Smith, and of course Paula is our facilitator. This group is incredible. It's amazing to me that through Community Voice, which we talked about some yesterday, I was able to become a part of education and training, but I'm the rare example of who all is on this committee. These are incredibly bright minds that are giving of themselves to really make this initiative very, very successful for our community. And so I just want to point that out, and for you all to know that this group is diverse and they are covering all bases when it comes to this information. So we have the mental health toolkit. You can see some of the examples of it here. It's important to implement this for the mental health coordinators and the care centers so that they have the appropriate information to pass along to you. In the education and training bucket, we are creating materials that we can pass through this as well. There is a dedicated email address, mentalhealth@cff.org. And things are just constantly being updated for these centers, resources that are being made, things that they can do to further their efforts in the care centers. And again, a lot of that is being pulled through cff.org under that emotional wellness section. One other thing that you may want to take a look at that is more community facing that you can get your hands on immediately is this other web address here. And this does speak to the guidelines and looking at depression and anxiety so that you can get a little bit of background information on this. It would be probably a mistake for us to assume that this is information that you already totally understand. You get everything about it. You've seen your mental health care coordinator and you get it. You know what this initiative is and all of that. That's hard to do, right? You really need to have the ability to get on, look through the information, and find out what the resources are for yourself and where all of this is coming from and how it can impact you as a community. So I would urge you to go to that address and also to look at emotional wellness on cff.org. And then, of course, too, a welcome packet to the new mental health coordinators so that they understand that they are supported in this role. Yes, there is the seed funding to get them started, to get them going, but we really want them to be self-sustained too, and to continue in their care centers so that those services are provided to everyone that needs them in the community. And now I'm going to pass it back to Paula.
I'm going to go back to one thing because I wasn't planning on speaking about this, but hearing some of the conversations yesterday, I wanted to point out that we put together a resilience handout. And I think for this group, maybe it's something that I wanted to pull out. It is on cff.org on the emotional wellness page. I believe it's in a section called Caring for Someone with CF. It talks about the different stressors in life. And again, making this is normal. There are stresses in life, and resilience means to bounce back. It doesn't mean to be able to say, yeah, I got this, but a way to bounce back, and also to make sure that you focus on self-care. And I wanted to point that out just to say, don't ever feel guilty about taking that time that you maybe as a parent need or as a spouse that you need for self-care. It is impossible for an empty cup to pour out, right? So you have to be filled. You have to keep refilling and refreshing. So that might be something that you want to look at. And if you're from a chapter, that might be something that you might want to order and hand out and have available to your families. So I thought it would be nice to mention that. Okay, on to the consultation group, another work group. I say they broke up into 3 work groups with the emphasis on work. The consultation work group has joined together with some peer consultations. They recognize that they need to help and support each other, and the CF Foundation has offered the virtual platform for them to do that. They started out with learning about cognitive behavioral therapy, and they went through a book and learned how to do that. And now they've decided to stay in those groups and to help each other discuss difficult cases and maybe help each other figure out the referral pathway and how to do that better. We also understand that sustaining this position is a tough ask for some of these care centers. And so this group put together a Billing 101 document as well as some sustainability worksheets and resources. We've also started a mentoring program where somebody who is a seasoned mental health coordinator will be paired with somebody who is younger to our community, and that seems to be very successful. And what we've just started out is for a telebehavioral health pilot. What we've done is we brought in 10 mental health coordinators. We brought them to the CF Foundation in January, and we're working with an organization called the Telebehavioral Health Institute, and they are helping that group learn about the ins and outs and the proper way to provide telebehavioral health. And we hope then that we will be able to spread that information throughout our community. So I hope that you'll be hearing more about that next year. We also have worked with care teams in order to provide a change package. A change package is something in quality improvement that we talk about. Basically a step-by-step how-to manual with resources embedded into it. The care teams can go in and read and pull out the resources that are important to them and helpful for them. And we found this to be really very successful. One thing that care teams must do is to track if you're screening somebody annually, you have to track that. You've screened, now you want to send them for referral, you have to keep track of that. So what we have tried to do is make that as easy as possible for them. And we've worked with members from our registry team to put together a mental health screening tracking log. This is for the care centers. This information does not come back to the CF Foundation. This is just really a super Excel spreadsheet for care team members to take a look at and to follow and to pull out trends. And they can pull out their own reports. And it's really made life a little bit easier for them, I hope, that they don't have to make their own tracking log up for themselves. Well, what have we seen? Have we seen a difference? What we have seen in the registry is that people are being screened more frequently. As I mentioned, this was just rolled out in October of 2015, that recommendation. So what we've seen is, in 2016, more individuals were screened for depression as well as anxiety. And then we saw an increase in 2017. I don't yet have the 2018 data yet. They just had the data lock earlier this month, so we will have more information. But I anticipate that number and that rate just continues to increase. But we've also seen through our experience of care survey that individuals with CF as well as parent caregivers recognize that people are asking them more about their mental health. So it's not just the screening, but it's also that people care. People are asking, people are concerned. If you don't know about the Experience of Care survey, that is a survey that is deployed by care centers through a vendor that we have, and it's deployed twice a year, no more than twice a year, after a clinic appointment. So we're happy to see that those trends are improving, and in fact, this was the most improved measure on the Experience of Care survey. Well, perhaps CF Peer Connect can also be a way that we can help prevent mental health issues. It by no means is meant to take the place of mental health counseling, but we are trying to also look at preventative measures. Maybe if we can connect people to each other to talk about those similar situations, maybe that will help. And I asked Ginger if she would come up and share some stories, or at least a story that she's heard of how CF Peer Connect has helped in the community. Ginger?
So, admittedly, CF Peer Connect is not something yet that I personally, and to my knowledge, my husband, has not taken advantage of. But it really hit me this year at Volunteer Leadership Conference. Yesterday with Ray Poole that's sitting here, we got to be a part of a panel talking about Compass and CF Peer Connect and these incredible programs that we have through the Cystic Fibrosis Foundation. And I started really picking up on it because I was more aware of it. That's what happens, right? You sit in something like this, you hear about it, you start to notice when people talk about these things. So that's happened for me just recently. And one of the other people on that panel with us talked about how, like with CF Peer Connect, if you are a spouse, perhaps, that you have someone that you love that's going through double lung transplant and you're sitting in the hospital, it's a weekend. It gets kind of quiet in the hospital on the weekend. That can be a scary time, right? Someone's gone through a double lung transplant. They're probably not necessarily sitting there hanging out with you, doing the typical things that you would do on a weekend, right? Maybe the only person that really could understand that is someone else that's been through it. And that made so much sense to me. It resonated so much with me. Maybe because I've spent my own time in the hospital on weekends, and it is eerily quiet. It's just different. Ray's shaking his head. Yeah, it's just like a weird time to be in the hospital. During the week, things are buzzing, they're moving around, there's a lot of people coming in and out, which also can be kind of exhausting. But it's busy, and times like that on the weekend when it's not busy can feel really, really lonely. And so I think part of what Paul is saying about CF Peer Connect and these stories that I've heard about it is that you can partner with someone through this program that can just share some of that with you, that can walk shoulder to shoulder with you, that understands it and can really speak to it in a very personal way. The other story that I didn't expect to hear because I didn't know he'd be talking about it was yesterday morning. Remember, Drew Struby was talking about men and CF Peer Connect and how he's talked to other men in the CF community. And so many times there's that like loneliness and stigma there that they're not the ones maybe always talking about neb cups, or there's this Facebook group that I know that I'm a part of that it's moms for the majority, and there's constant chatter, constant. Anything you kind of want to hear a little feedback on, you can get it there. I don't know that there is that for dads, and I don't know that even if there is something that dads are using it as much. So to hear Drew speak to that and to say, listen, I've experienced that there are dads out there or there are spouses out there that really need to connect on that level, and this is a program that can help them do that. It really showed me the power of something that honestly I hadn't come to recognize yet. And so I hope for our family in some ways we can find a way to use that now that it is available for families too. So, and you probably have your own stories, and maybe later you can share some of those too.
Thank you. I think that also the way of connecting the community is through our CFF Cares events. It's just a way to support one another, and I just wanted to put a plug in for that. So in 2017, when we focused on mental health and building out the emotional wellness section on CFF.org, we really focused on depression and anxiety, and those handouts and that information around depression and anxiety, and what those guidelines would mean for our community. And in 2018, we built out the section on substance misuse. You know, opioid addiction is something throughout our country that's been an issue. And in CF, we're not immune to it. And we heard some stories, and we have some information and videos on the CF Foundation website. There's one story of a mother who lost a child. Her child had CF, but she didn't lose her to CF. She lost her to substance misuse. And we also have a success story. A young lady who has CF, who fell into substance misuse and now is recovering. And she has a wonderful relationship with her mental health coordinator, and she's really on a great path. So I just recommend you take a look at that, and that's there for you. In 2019, the Mental Health Advisory Committee is going to focus on procedural anxiety. It was interesting that yesterday we heard somebody talk about that. Actually, I guess it was Summer and the group, they talked about procedural anxiety. And we've already started to work and look at that. We have brought together some subject matter experts, and we're planning on a couple of videos to focus not just on the pediatric population, but also on the adult population. So we look forward to sharing that with you next year. Our goal is that we're able to utilize it at the North American Conference and help clinicians understand how they can help their patients and families work through procedural anxiety, and then it will be posted on the website, cff.org. And we have something that we are so excited to be able to roll out. And I want Ginger to talk to you about it because she championed this for you. You will see them on your table, and I want her to talk to you.
Thank you, Paula. Gosh, I'm so excited, y'all, to tell you about this. It looks like probably, you get a lot of paper at things like this, right? And I always stick them in my agenda, and then I get on the plane, I'm looking through them. I really like them, all of this, but you never maybe quite understand what came before the paper was printed, and you were able to pass it along. But this has been a labor of love, but one that we're so excited to get to share with you today. You're really the first people to get to see this. It's not yet gone out to mental health coordinators. It's not in your chapters yet, so you're the first ones. Aren't you excited? Yay! But while we had the idea to do this and we wanted to create this for you, there really was something fantastic that was already out there that we could modify. So we did partner some on this, but we really tailored it to where it would fit for our community. And I can speak to it personally for you, why I felt that it was so important. I mentioned earlier, we are a family unit living with cystic fibrosis. It is my son King that was diagnosed with cystic fibrosis, but it affects my daughter, Emma Virginia, who is his older sister. She's 10, very, very much. And I see some of you shaking your heads. You recognize that, right? It's a lot for a sibling to shoulder. I think siblings in general have these really dynamic, amazing, yet very difficult relationships sometimes. And so I know for Emma Virginia, it's been so hard. She loves her brother so much, but gosh, she misses mom and dad when they leave for 28 days to go to the hospital. Who wouldn't? What child wouldn't? What 10-year-old child would not have a hard time with that? On the other hand, what I recognize is that for me to be whole and really care for King in the best way that I can, I need for Emma Virginia to really be focused on as well. And I need for her to be whole. That's like any parents with any children, right? It's the push and pull and the balance. So this felt very important, and it felt like something that we had not yet focused on, but I knew for us personally we were dealing with, and I started to hear that so many other people were as well. So you have this handout, and you can see it just what I think this can do for your families, and when you take it back to your communities, and hopefully when it comes to your care centers, is normalize some of that behavior, right? That sibling's not being a bad child because they're upset or they're jealous because their sibling got 8 million balloons when they were in the hospital. That doesn't feel fair, So I hope that this can normalize some of that behavior. And even maybe if you're a parent, a grandparent, a sibling yourself, an executive director that can take it back to your chapter and share it, you can just show that these things are maybe even to be expected with siblings, and it's okay. And these are some ways that you can look at it. This is a lens in which you can see what might be going on in that relationship, again, because it's very dynamic, and some ways to deal with that. So we hope that this will be a really great piece for you, and that it will be something that will really just open conversations and kind of peek behind that curtain, and there will be a little less stigma. So hope you enjoy it.
She really did champion this for you. She found this document, and she reached out to the original authors, and she asked if we could adapt it, and she worked on adapting it. We have thoroughly enjoyed Ginger being part of the Mental Health Advisory Committee, but really have appreciated her insight and just also her tenacity, right? Because she had to bring this to a group of experts, right? But she is the expert, and they recognize that. They recognize that. And you are also experts. So now we're going to turn things around, and I'm going to ask for questions, but also for comments and suggestions. I know that many of you will have suggestions, but again, I'd like you to come up to the microphone, or you can ask your questions online. Good.
I'm a volunteer.
I don't think.
There
Okay,
we go.
good.
Hi, everybody. My name is John. I'm a volunteer from the Connecticut chapter. It's wonderful to hear everything that you're doing. But a question for you, as a volunteer, do you have a suggestion how I can make an impact, since I'm not on the front lines, at the care centers, to facilitate, people getting the mental health that they help that they need?
Yeah, that's a tough one, but I think sometimes to know what's available is number one, right? So that then you can offer suggestions, and also I guess it depends on where people are in their journey and what help that they need. Sometimes it's just connecting with others, so showing them where CF Peer Connect, maybe that they can sign up for CF Peer Connect, or getting involved in CFF Cares if that's what they need, but also referring them back to their care center and encouraging them to have open, honest conversations with their team. I hope that helps.
Hi, my name is Anna Jenkins, and I have 3 sons, all in their 30s. And my middle son, Eric, who is 38, has CF. I'm also a pediatric registered nurse with 30 years of experience, which kind of adds to I know more than I should when it comes to all kinds of aspects related to his health. However, as an adult with CF, and his siblings don't all live in the same area now, but even growing up, but now that mental health has come into more of a forefront as something that we need to address and talk about, it's very, very different as an adult than it is with children, because I have no HIPAA control over being able to say, Eric, you need to go see somebody, or Billy, you need to go see somebody, or Chris, you need to go see somebody, or my own brothers and sisters, hey, this is what I recommend. But there's a disconnect, I think, even at his care center in Dallas, because there's not as much of a focus on it from what Eric said. I mean, he'll tell me, he goes, Mom, I'm not mental, I promise. But they'll send a social worker in just to talk. And, he goes through the various people for his CF clinic visits. But how do we encourage without feeling like we're forcing them to do something they don't want to do? If we know it would be a benefit, how do we encourage them to get there without trying to control what they do? I mean, he's 38 years old. He's an adult, and he's doing fantastic. But,
So as an adult, they are there now to make their own choices, but sometimes it's even just modeling our own behavior. If we feel that maybe we need to have someone to talk with, sometimes that's the way. Sometimes it's just again, pointing out the resources that are available. It is very difficult when you're a parent of an adult, because it's a different model than it was when they were in pediatrics. All I can say is that, yes, we recognize that it is difficult, and I hope that some of the resources that are available online to them might be something that they take advantage of, because they won't see it as you said it. I'm not pointing it, but you said, he said to you, I'm not mental. That we can start to normalize this, right? That's what we're really trying to do, is just really start to normalize the conversations. And it's going to take time, I think.
Some of them see, and I'm just speaking of my son, there's a stigma associated with saying, There is a stigma, and it's not just in CF, right? So that was the comment for those people online. There's a stigma associated with saying I need help, and that's unfortunately the way it is in our society. But we want to start to normalize this and have these conversations. It's going to take time, but I think we're going to get there. Go ahead.
Hi, my name is Kelly Amsler, and thank you so much for being here. And I'm here with my family, my brother and my parents over there. But I'm a sibling of someone with CF, and so I just wanted to make a comment to say thank you for talking about this and for bringing this issue up. My sister's 28 years old, so she is a CF adult, and we're her older siblings. We love being her older siblings. So I just want to encourage you, Ginger, that I thought you might have asked my parents to write this because I was reading through it, and we grew up with these 10 steps, and it is spot on. And I just want to let you know that it works, and we're really, really thankful. So I just want to encourage other people to follow these steps, and parents and siblings, because we're really glad to have this. So thank you for sharing this.
That's great. I just want to make sure that those of you know this really isn't even hot off the presses. We had to copy these. This is actually at the printer as we speak, so they will be available for care centers to order shortly, as well as for chapters.
Hi, my name is Crystal. I'm from Bakersfield, and I have a godson with CF. His name is Gus, and he's 5. And he is welcoming a new little brother this year, so I'm so excited about that handout so that we can help the family. I have a comment and a question. My comment is that for me, myself, I find it very helpful just to have a mental health provider and see them on a regular basis, just as kind of like a place to dump, a sounding board, kind of to check in, and before there is those feelings of depression and anxiety, because it's hard to come out of the hole. And then my question is, maybe for somebody who isn't near a mental health coordinator that's from CFF to the care centers, I find that it's really important that your therapist, your psychologist, your psychiatrist, you connect with them and that you kind of interview them in that initial meeting. So what do you think are some of the questions that should be asked to know that they have the specific training to help with somebody caring for chronic illnesses, with all these different issues?
Yeah, that's a tough one. A lot of times it's just a personal connection, right, that you feel connected, but sometimes we've heard from the community it's difficult to go see a mental health provider that's not part of the CF care team because they don't understand CF. And then you're spending your first 2 sessions talking about CF. So what the Mental Health Advisory Committee has provided to care teams is really a PowerPoint presentation for the non-CF mental health provider, just to give them some information about CF, like basically CF basics. And actually, they've also submitted a paper, a manuscript, hoping that we can get this information out to the broader community. So we recognize that that's an issue, and they're trying to do what they can help. But that's a good point. I'm going to go to a question that's online, and the question was, being screened for mental health is great, but it's very difficult for parents to make additional doctor appointment on top of their work and their children's appointments to get any necessary treatments. Are there any efforts to help the clinicians provide treatment to the adults? Well, I will say that I'm hoping that the telebehavioral health, if I'm understanding that question properly, that might be a way that we can provide resources and help for that community. People can't come into clinic, or maybe they can't make another appointment, that perhaps if we have that right to their home, that maybe that would be something that would be helpful. So we'll see how that works out.
So my name is Tiffany, and I have a 5-year-old with CF. My question, right now he's all about it. He knows he has it, but he doesn't quite grasp it, but he knows what he needs. He tells people all about it, and he's energetic about it. But my fear is that as he becomes older, a teenager, he's going to resent and hate life, and he's going to miss out on things. So do you have any pointers of how to sort of keep him embracing it and understanding without going to, not that everybody goes to the darkness, but it is a fear of mine that he is going to end up resenting everything because of it.
Sure. Well, I think, first of all, you're thinking about it. That's the first step, right? You're trying to be proactive and prevent these things from occurring. I think it might be helpful to talk to your care team about even your fears of what's going to happen, and see what recommendations they can give you. And also it'll kind of put their antenna up so that they can think about this as well. And when they start to see changes, and you start to see maybe changes, right, that they can work with you. Again, we all have to deal with anxiety and depression potentially, right? And we want to build that resilience in all of us, in our children, as well as all of you. So I would say, I would really encourage you to have conversation with your care team.
Thank you.
Mm-hmm. A question, speaking of care team, what resources can or will be available for families not in a care center? Well, we did mention those things that are online. So whoever sent that in, I hope that you go onto the emotional wellness page on cff.org and see what's available to you there. Of course, you're always welcome to visit your chapter and talk to your chapter about what's available and maybe get involved in CF Peer Connect or CFF Cares events. But also, I guess, can you think of anything else that maybe they would be able to tap into?
I would just, reiterate what Paula said, to really go on cff.org. I think a lot of times we say that in these meetings like this, and when you go on the landing page, you think, okay, there's this. There are so many layers beneath that sometimes, and I really like the website and like to noodle around on it. I do. But there are things that are constantly being refreshed, constantly being added. So, I think that really getting on that website, really diving into what is there are so many layers. There's blog posts where people are talking about their personal experience with emotional wellness. There's lots of things there. And I also think that some of these virtual conferences that just connect people together, give that sense of community. And so, while you're not going to get professional advice about mental health there, you will get a lot of support. So I think that'd be great.
Hi, excuse me. My name is Ray Poole, and I'm a spouse of somebody with CF. One of the things that I just wanted to make a comment that I found really interesting was I felt I underestimated the value of Peer Connect and talking to other people that had those similar experiences. And after my wife's transplant, she was experiencing some depression and some anxiety. And I remember encouraging her. She ended up getting involved with BreatheCon, one of the virtual events, started talking more to other people in the community. And she really gained a lot from it. And I thought, oh, that's so great for her. And then I ended up getting involved with one of the events myself and having the chance to talk to other CF spouses. And I realized that there was a lot of value in that for me. And I didn't even recognize it. When I agreed to facilitate one of the meetings, it was, oh yeah, I'll be nice, I'll facilitate that. But then I got involved with it and I was like, wow, this is really helpful for me. So it was just something that I'd undervalued, and I think it's great that there's the Peer Connect, and that's available, and the virtual events as well.
That's a great plug. I think there was a little message that came to me here, reminding the parents of adults with CF that those feelings that were shared are common feelings, and that perhaps you might want to contact CF Peer Connect and be connected with somebody else who has gone through that, and maybe that they can help you and give you some practical advice, or just talk to you about what they did. So the plug for CF Peer Connect.
Hi, I'm Cheney Kurtz, and I have a daughter who's 15, and she sees a counselor that is focused on chronic illness, and so she has been getting services. But one of the things that I haven't been able to find on the website, and so I'm just looking for some resources of mental health things that are helpful for patients who are like 12 to 15, because they're not quite old enough to do the peer-to-peer, but yet they feel isolated from the CF community, like, oh, Mom, you get to go to San Diego, and I'm the one who has the disease. And so there's a big gap for that age group when they're really, because a lot of them are quite mature in handling all their medicines and just daily life, that they're ready for some interaction with the CF community before they're actually allowed to, I guess.
Yes, and that group recognizes that. Do we have somebody from CF Peer Connect here that knows what they're... I know Amy is working on trying to connect. Amy Jeffrey works with CF Peer Connect, and she's working on ways to try and connect with those tweens, and maybe Danielle can talk about that.
Yeah, absolutely. So if you go to cff.org/teen support, I believe it is, we are collecting the names of folks that, any teens that want to get involved. We don't have any programs yet, but we've been hosting groups to talk to teens to hear more from them, what they would like to see. And all the programs are available 16 and up right now. But yeah, if you have anyone in your life who would be willing to sign up for that, we hear a lot from parents of what they want to see for their kids, but not a lot from the teens themselves, and we're having a hard time contacting those teens. So if you know any, please send them our way.
Thanks, Danielle.
Thanks.
Hi there. My name is Amy Rove Gregory. I'm a mom of 4, 2 with CF. And I just wanted to thank you guys. Ginger, I think this whole siblings piece was like a missing link. And I know with our chapter, I was talking about it a lot to try to see what we could do. My story was a little different because one of my CFers is also a twin, and her twin does not have CF. So that piece kind of adds a whole nother layer. So right now I'm kind of in this midst of struggling, and the twins are heading to middle school, so that adds a whole nother layer. And so all of a sudden my older one with CF that's heading to middle school, the twin, she now doesn't want anyone to know she has CF, and she's gone from this period of major advocacy and fundraising in our community to now like, I'm heading to a new school, I don't want anyone to know. And her twin, who has always been, it's not fair, my little sister has CF, my twin has CF, they have all this treatment that they get, so she kind of went through this woe is me period to now she really wants to advocate, but her twin's like, don't use my name, don't talk about it. So, and then as the mom, you're like, I have to respect that, but just trying to navigate it. So I was wondering, beyond these documents, which are wonderful, is there any other talk about some sort of almost like a peer connect or a support group, something even online that could be done? I'm planning to talk to our CF clinic about seeing if there's a way just to set up something local, because as local parents, we get together, CF parents, but there's just not a lot for the siblings.
Yeah, I believe that CF Peer Connect is open to family members, including siblings, depending on the age, though, however, right? So they'd have to be 16 and older. But that is something we'll bring back and talk about, and maybe even connect with you to see if you have some ideas.
Hi there. My name is Mike Buscemi. I'm from the Greater New York chapter. I've been working with the CF community for about 18 years, and something that I've always found fascinating. And it's amazing that mental health is now being such a focal point for the foundation, but something that I've experienced over my time is how parents deal with teaching their children about the disease. And I'm wondering if there's any focus on the mental health outreach and efforts at the care center level on sort of viewing some of those signs with the parents. Because I've seen many parents jump in with 2 feet, they get involved, and then there are other parents that kind of shy away, and they're not vocal, and they're not sitting on a panel. Their chances are probably not here today. So are there any efforts to really focus on the parents and how they disseminate that information to their child?
Yeah, that's a good point. I think it really is the responsibility of the care teams. Again, the recommendation is that parent caregivers should be screened annually for anxiety and depression if their child is 17 or younger. However, a lot of organizations will not allow that to occur, just purely because they don't see that parent as the patient, and they just don't allow it. And there are some teams that are, just like anything else, there are some teams that are probably more aware of that and who are better able to to do that. And I think maybe we just need to figure out how do we find those teams and share that information and find out who's done it really well and push that out to care teams so that others can learn from them. Ginger, do you have anything that I
always have things to say. But I think that speaking to your point, but also to several other things that I've heard some of you saying, a lot of times organizations, even this one, your care centers, they need to know that this is a focus for you, that this is a priority for you. Your chapters need to know that this is information that you want to hear. A lot of times we talk about, of course, the importance of these modulators, of a cure, of fundraising, of all of these things. But there is no health without mental health, as Paula once told us at NACFC and then VLC in 2015. And I think that that's a great base for you to work off of, and just continue to use your voices and share that you think that this is a priority. Because without you using your voices, it will only go so far, right? The more people that need and desire this information and see it as something that can make a tremendous impact, the better. So I would urge you to do that.
I'm Ryan McHugh. I'm from the Utah chapter. My son Simon is 16 years old. He's a wonderful, fun, lovable kid. Through his life, he was always very compliant with everything he needed to do and was cheerful about it. He was an inspiration to us as parents. Then he turned 16. Thank you, exactly. And so recently, he's entered that dark phase of being an adolescent, and we're at a loss. There are so many resources that are out there that we think could help him. If he knew I was talking about him right now, he would be so annoyed. He would be... and anytime his mom wants to post anything on Instagram about the CF cause, he gets so annoyed. Hates having his picture taken because he assumes we're going to use it for advocacy. So... I don't know what to do for him, and others have expressed their concern that when their kids get to be adolescents, that they might go through this. I have every confidence he's going to snap out of it, and he's going to, but there's that time when you have to mature emotionally to recognize what resources are available to you and that you can really ask for help. But does anybody have any advice as to how to deal with someone who does not want help?
Yeah, it's difficult. It is. I mean, we all recognize that it is difficult, and I would recommend, and really encourage you to speak to your care team about this and see if they can help, and if they can, come alongside you, and also for you maybe to consider reaching out to CF Peer Connect and talking with somebody else who's gone through that, who's had a child who has gone through adolescence and made it to the other side, right? So that would be my recommendation.
Thank you.
Hey there, I'm Laura Brown. I'm from Houston, Texas, and I have an almost 10-year-old with CF. I'm also on our family advisory board for Texas Children's Hospital, and I'm also a social worker, so bear with me because this is all kind of inclusive in my head. Touching on the sibling situation, I can't speak for other states, but I know that in the Gulf Coast area in Texas, we have a sibling camp that our family advisory board actually sponsors siblings of CF patients to bus. It's about 4 hours away, but we bus them there, and it's a weekend-long endeavor with child life specialists and nurses staying on site. There's no parents. It's kind of frustrating because I want to go, but I can't. And it's just about normalcy for siblings, a little bit of a mental health component, understanding what your sibling is going through and understanding that you have support even though you're not officially the one getting, all the attention, I guess, that you get from CF. So I do encourage you to maybe talk to your care team, specifically if you have a child life specialist, or ask to talk to a child life specialist at your hospital. And I do realize, I apologize, this is predominantly pediatric, but you may have some sort of resource close by like that could benefit your sibling. But also speaking, my oldest is 12 or almost 12. She doesn't want to go. She doesn't want to talk. She doesn't want to share. So I think talking again with your child life specialist or your social worker who's probably got more of a behavioral health specialization, which means they work in a capacity that helps balance medical with mental health in a fast way because they know they don't have a lot of time with you at your appointments, can be really beneficial. And they'll be able to give you resources similar to what you can get on cff.org through, connecting. But it's really important to use those resources. You are there every few months with your child. And they come in with a screening. You may not understand when they go, so how are you? That they're actually looking to be able to provide you with some more information. And if you can prompt them, there's books, there's people, there's studies, there's some way or some person on staff that they'll call in to help with what you need as a parent or what your sibling needs or especially what your CFR might need. So I just wanted to encourage that.
Thank you. We're really actually at the end. We're being told that. So
there's something really, really, really important. I do too. So
Can I say it quickly? I'm Lori Ambrose from Utah, mother of 5 children. Our 5th child has cystic fibrosis, but we had some. This is brilliant. Can I just say thank you? I wish I'd had it 18 years ago. Our 4th child, and to the father of the 16-year-old, our 4th child really struggled with the sibling and all this. But I have to tell you, he is currently, he's used as a positive, he is currently getting his master's in mental health counseling, and because he's experienced it. I think this is brilliant. Thank you.
Yes, thank you. I just wanted to say real quick, my daughter Lindsay, I'm Katrina from this Tucson, Arizona chapter, and we have a 21-year-old with cystic fibrosis, and his beautiful sister, Lindsay, just started this year a teenage board, okay? She has gathered anywhere from 7 to 19 teenagers, has 2 people on the board with cystic fibrosis. You guys, you need all of you guys that are struggling with teenagers because it was our fear too. She's done it. She's got the board. She's got the support. But she's got an Instagram. We would love to support your teens. We would love it. It was our fear. And they're doing so good. She brings balloons. She brings balloons to your teenagers with cystic fibrosis in the hospital.
Thank you.
Thank
you.
Thank you so much for sharing that. And on a really quick correction, it's cff.org/teen sign up. I know I saw people writing it down, so thank you for the correction. And they will need parental consent after they sign up. Thank you for sharing that.
Well, thank you, everybody. You were very engaging. I appreciate it. Thank you.